And then the last thing I want to talk about is that I know a big subject is the Medicare commission. It has been in there for a while. The president talked about it last Wednesday at the news conference, and that is going to be a big area of debate, I think, because that is changing the face of medicine a little bit. And I think there'll be a lot of conversation on how we want the government involved in that area, and I think that will be a big area that could cause some challenges for this legislation as a whole.
Very good, Victor. Thank you very much for touching on that. While folks are thinking about questions they have for you to come on up to the mic, I have a question for you. Bottom line, honestly, intellectually honest, what's going to happen to the private insurance industry?
Well, it depends. I mean, I don't think that the bill in its current form has a chance to pass, really. I really don't think it will pass. The Senate has come out and said that they need Republican support. When they said that, they said that we need to change the bill significantly to get it passed. So the bill that the House especially presented is just not going to, it's not going anyplace. But if it does pass, or if anything close to that passes, then private insurance within a decade will be pretty close to that.
Did you hear that? Pretty close to? It's gone. Okay. Thank you. All right. Question.
Hi, Dave Wachter. Tell you where I'm coming from. I don't think the government delivers anything efficiently. Any faith in Medicare is you'll find that we're 37 trillion unfunded liabilities there. How the rest of the country on we're toast as a country. But I have a couple questions about some of the rules that govern insurance. When you look at insurance, if you're going to insure your own car, that would be unbelievably expensive. You get the whole neighborhood, you get 10,000 people. It's not everyone's going to have an accident. What's the problem with having group policies? Where's this being blocked? Where you have group policies, so if you're not working, you can get out and as an individual, and you can join some group. And then why can't I buy insurance out of Utah that's cheaper than California? Is another question.
The reason, let me hit the second part first. The reason why health insurance is cheaper in one area than another, let's use Los Angeles as an example. An HMO is a lot cheaper in LA, but a PPO is a lot more expensive. It has to do with provider contracts. And so if you were to buy a policy living here in Santa Rosa in Utah, where you have to, if it was less expensive there, it really isn't, it doesn't translate, because really it's based on the insurance company's contracts here, along with the overall experience in this area that a health insurance plan has, utilization and those factors, but it comes down to cost. So the state thing doesn't work real well. Associations, that's a difficult one. What they passed a law in California in '92, I believe, and it reformed small group. And basically we created one big pool for employers. And they, at that time, outlawed association health plans. But we would take a long time going there. But basically, associations in the state have been outlawed, at least as far as starting new ones. There's existing ones that were grandfathered. North Coast Builders Exchange would be a great example.
I've received very good information from some of the groups that are really pushing a lot of this change in the legislation are insurance companies, because they will be the ones who will ultimately run the program, since the government is not ready to step in and actually run day-to-day government. And it would also give them a chance to drop all their salesmen. They would actually make more money. And I know that ARP is supporting this plan. So I think there's a whole lot of people here who have, who are thinking of great ways to make money at the benefit for themselves.
That's a hard. I think that there's insurance companies are supporting aspects of the plan because they want to see it at the table a lot of times. I know the professional association I belong to have supported things in the past because they want to have a voice in it. I think that's where I've seen most of the insurance companies. I think the ARP is an interesting one. AARP, they do have, they're a large insurance company, or a large insurance brokerage, so I think that's an interesting one, and I don't have a lot of knowledge there.
Okay, let's try to keep questions short and answers short so we can get everybody
Okay.
to move on.
I had a great insurance policy up until this year. It priced me totally out, increasing it over $200 a month for the premium, which brought it up to over 54% of my bring home income. So I'm uninsured. I wonder, what are the insurance companies prepared to do to make premiums affordable? I don't want a government option. I wouldn't call it an option, it's a mandate. I want to buy insurance. I want to be able to afford the premium. And maybe have an option to pay for my own basic care, but have an insurance plan that would cover something catastrophic like cancer or something like that. And I don't see that being offered anywhere.
Well, I have one of those. I have a health savings account compatible plan. My deductible for my family is $6,000, and that's the kind of plans that a lot of people are purchasing now because they want to cover the catastrophic but handle the basic themselves. I think one of the areas that we're going to get a lot of discussion on right now is covering people with different types of plans and having choice, and that we'll have to see. I think there is a lot of choice in the market right now as far as ranges of benefits from each insurance company.
But not affordability.
Well, affordability is a big issue, and maybe part of that, the thought process of shrinking the age bands, is making it less expensive for some and more expensive for others.
Since you have been in Washington, D.C. speaking to the politicians, I'm curious to know how much thought has been given to how this will affect many types of employment. For example, I'm a part-time college instructor, and we don't have any benefits. And if the state were required, I'm sure that we wouldn't have any college instructors left. Or what about the person, like for example, I've had my mother who had lived with us that we took care of for years and had to hire a part-time aide to come into the home and work. You couldn't afford to do that if you had to pay someone's insurance as well. Has there been any thought that's gone into this and how it's going to affect potential jobs in the future?
That wasn't part of our discussions. You get about 15 to 20, maybe 30 minutes on the outside, and we really talked about two things: the public plan when we met with legislators, and then the public plan, and then and we also did discuss guarantee issue and how that might affect it. But I think part-time help and how they do this, as far as what a company will have to provide for part-time employees, is a big aspect. It's going to be something to watch.
You and Mike both hit on the subject of employers gravitating to this new plan because of economics. My question to you, and maybe both of you, is what about the retirees that already have a plan in place? Where do you see that going should this go into effect?
I think they'll gravitate. I think there's some interesting parts in there, and I'm not real strong on what it's going to do with retirees, but the government's going to do some subsidies, because one of the issues here, I don't know if the big insurance companies are for it, but a lot of the big automakers are, because retiree health care is hitting them so hard that they are the ones that are backing a lot of these ideas.
You sound confident that the plan in its third form doesn't have a good chance of passing. And who knows what that is, I guess we do. Does Nancy Pelosi have a way to backdoor this thing, or is that just rhetoric, or is she really on her rocker?
Okay. My response on Pelosi is Pelosi very well may have the votes to get it through the House, but then the Senate has to vote on it too. And I don't think they have it in the Senate to get it in this current form.